Yeah. Nick, are you good?
Yeah. From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. In the news this week, vomiting vultures invade Florida vacation home. The event was described as a vile, vicious, traumatic event.
Wow.
Also, but unrelated, vomiting vultures is the mascot of Jim's alma mater. And now, broadcasting from the churn, that guy's Dr. Jim Jobin. I'm Nick Tangeman. Time for some pod therapy.
Vomiting vultures would be a good metaphor to describe Liberty University.
It would be.
In a lot of ways.
Liberty University,
vomiting vultures. Yeah, that's not terrible.
It sounds like something Robin would have yelled at Batman back in the 60s.
Vomiting vultures, Batman!
Oh, speaking of which, they had a Batman marathon on the other day, and I was watching, and do you remember Batman Returns? It was the second one.
With Michael Keaton.
Yes,
Yeah.
after the 89
Danny
Batman.
DeVito's the Penguin.
Yes.
Yeah.
Have you watched that recently?
Not recently.
Post-Trump?
No.
You should.
Is Trump in it?
No. But, like, he
Oh,
becomes...
the Penguin, he's a politician.
Yeah, he becomes the mayor. He becomes the mayor. And I'm watching this, and I'm like, holy shit, this is believable. Like, and everything he's doing, you're like,
That's the villain.
And at one point, it became unrealistic. Like, it didn't match. It went completely the
when he
opposite.
straps rockets onto penguins.
No, that... No,
That's where I lost it.
MSNBC covered that. That happened. No, when... so Batman had recorded... he had a recording of the Penguin saying, like, I'll take care of those
and it goes
animals
to the media.
of whatever, and he patches it into like him giving a speech.
Was this the Access Hollywood video?
It was, except the big
I'm gonna
difference is
grab
that
you by the penguin.
Yeah.
the big difference was that the Penguin supporters turned on him.
Oh, that would never
and I'm
happen.
like, Trump supporters would never do
Nobody
that.
does that. I am appalled.
And I was like, now it's not realistic anymore.
That's
Because
where I
to do
draw the
that,
line.
somebody has to say that they might have been mistaken at some point.
Right.
Yeah, no, that's the trick. Never do it. Speaking of people who will probably say that they might have been mistaken at some point.
Great segue.
Great segue. We have officially received a video from nobody less than the great Dr. Drew Pinsky, and I have it queued up here.
I am positive you just mispronounced his name.
Pinsky! Dr. Drew Pinsky.
Hey, Dr.
You know what?
I think it's
Dr.
Penske.
Drew here. And
Penske's
an
a truck.
anonymous fan sent me in, a fan of your podcast, and I don't know if this is a man or woman, but he or she specifically wanted me to convey to you how important he or she thinks your work is, and more importantly, how valuable your podcast is, particularly addressing the issues of mental health and stigma and we live in this polarized world where mental health
valuable.
is in short supply. I don't have to tell you guys
it
that.
is
I know
true.
how the work is. I know how hard it is to produce media that sort of gets into that sweet spot where we can make change.
It
but
is a sweet spot.
Personally, I want to congratulate you, Jim, Nick, for fighting the good fight and doing such great work. And your fan is...
a great person.
Well, this is a really serious fan. So,
He is a
she
serious
sent
fan.
me in, and I want to thank him or her. And
You're welcome. I love it. Oh, you can do anything with money. Dance, Drew.
Meanwhile, Jacob is throwing shit
Jacob
across
was
the
throwing
room.
pens at me. I think he was trying to hit the mic.
Now, why would Jacob do that?
I don't know. Just because Jacob is jealous.
So do we have
his
any
show-
idea what super fan, what Pod Therapy super fan paid for that?
Jacob, don't be jealous that Dr. Drew didn't endorse Ice Cream Social, okay? I'm sure one day one of your fans will anonymously get him to do that.
I am officially not jealous. I just want to know, do you have any idea who paid for that?
We did reveal it on the Patreon part of the content, and if you, dear listener, would like to know, you can go to patreon.com/therapy.
I think
sign up.
everybody knows.
For less than for a buck. You can sign up for a buck or better at patreon.com/therapy and find out. Because you know what? The anonymous fan revealed themselves.
And if you're a
nice
Patreon
person.
and the shameless behaviors of Jim disappoint you and you wish to cancel your Patreon, we understand.
No, you don't leave. You're in too deep. There's no leaving, guys. This show is Hotel California. You can check in
All right.
anytime you want, but you can never leave. So our show is now officially endorsed, loved on, hugged, fully supported by Dr. Drew. Wow. We've made it.
Amazing.
We did it, dude. This is it. This is the big time. This is as high as it gets.
Yeah, we've totally reached the top.
This is the tippy top. The pinnacle of greatness for podcasts. Next, Dr. Phil, as soon as he shows up on Cameo and puts his price up.
Yeah.
Oh, is he not on cam? He
He
seems
better
like
be
somebody
eventually.
that would be on there.
Oh, it's coming. It's coming.
Well, who raised him?
Yeah, if Dr. Phil gets on there, the next thing the anonymous fan should do is probably specifically ask him to denounce pod therapy. I think that needs to be the bit. Is like we're getting people to say. Don't
I think
listen
it'd be
to the
funny
show.
to have him denounce Dr. Drew.
Oh, that would be hilarious. See if we can start a flame war.
That would be even better.
I just want to take a second. Well, you know, Dr. Drew, we be shit, okay? You don't know nothing. And I would fight to defend Drew's honor, Phil, because Drew is in the pod therapy corner. So if this thing turns into a psychotherapist street fight, we're on Team Drew.
There are a few doctors on Cameo. The number one doctor, whenever you just search
Dr. Oz?
for DR.
Is he in there?
Dr. Oz not on there, but Dr. Sandra Lee, a.k.a. Dr. Pimple Popper.
Wow. Wow. Okay. That's a good endorsement, too.
And there are a lot of plastic surgeons.
Yeah, it feels right. I think that would be a good thing. So, but anyway, our show is now officially supported by Dr. Drew.
Officially, the
Officially.
check has cash.
The check is cashed. Okay,
It's cleared.
That money was
The check is
green,
cleared.
and we got it. So thank you, Drew, for endorsing our show. And you know, maybe one day you'll make it too, bud. You just keep swinging that bat.
Right.
All right. So we
Well, I
got
guess
some
let's do our
letters.
show.
Yeah, well, so since our now Dr. Drew approved show, we have to bring out our best work, dude, because I'm only assuming that Drew is listening to the show. So,
Right.
All right, first letter, how to care for the mental health of my father as he cares for my uncle. Hi, guys. I really love the show. You two have gotten me through a lot of long car rides through the Nevada desert. Sorry for the long email, but there is some family history that's important to the question. I'm dealing with a situation that has had a serious impact on the mental health of my entire family. My father has been caring for my elderly uncle, the brother of my deceased mother, for about 4 years. My uncle has Parkinson's disease and a host of other things. He takes 12 different medications daily. While he has a nurse come to do the gross stuff, my dad takes care of my uncle's financials, shopping, and is basically his connection to the world. My uncle has had mental issues for a long time, but no one ever talked about it, and he's never been to therapy. He lived with my grandmother, who took care of him until the day she died. He worked dead-end jobs, never dated, never went on vacation, and didn't really have any social circle at all. He is often selfish and lies constantly. After a mental evaluation following yet another hospital visit, we were told that he makes decisions at the level of a 10-year-old, with no respect for long-term consequences. This caused a lot of tension between he and my father, as my dad didn't like that my 90-year-old grandmother was caring for my uncle as if he was still a 10-year-old. Despite this, when my uncle couldn't care for himself, my father moved in with his family, new wife and young kids, as he doesn't have anyone else in the world. While things were never great, they are getting much worse. About every 2 months, I get a call from my father saying, "I can't take this. I don't know what to do anymore." My response is usually to fly in for a few days, spend some time with my uncle, help pay some bills, and set up some doctor's appointments, and then I fly home. I think that it helps them reset their relationship a bit, and more than that, it helps me get rid of some of my own guilt. I love my uncle. He's always been good to me, and he's family, but I can't take care of him myself. Even if I could take him, my father would never let me, as he believes that it's my time to start my own family without the extra responsibility. I'm not even sure what my question is, other than being there for my dad and uncle over the phone and visiting every few months. Is there anything else that I can be doing to help them? My father's about to turn 70 and not in great health himself. He has diabetes, and his doctor is constantly telling him that his stress level is dangerously high. My personal guilt level is off the charts, but at the same time, I really don't know what I can do without ruining my relationship and seriously damaging my career. Any advice would be great. Thank you guys again for everything, Anonymous.
Wow.
That's a good one.
That is a good one. So I'm kind of rereading it because I got a little confused. So
Before you guys talk about it, I just want to say that I love this guy's father.
Yeah.
Yeah.
For,
The father,
like, stepping up.
who's like, nope, I'm dealing with this. You do your thing.
Yeah.
Man, do I love your dad.
That's an awesome dad move right
Yeah,
there.
that's great.
To just protect him from that. Like the writer says, even if I wanted to take the uncle,
Yep.
he wouldn't let me do it.
Yeah.
He's going to throw himself on that grenade and say, get out of here. You go
Holy
live your
shit,
life.
good job, Dad.
Yeah, that's Father of the Year right there.
Yep.
And to the writer, I think, the thing that we have to look at here, Bud, is what you're doing is still really important. And you're saying like you're worried that you're not doing enough. And I get that, and I know that that's going to just be the reality of the situation. The reality of the situation is that this is not a solvable problem. This is a situation where this burden of the uncle is inherently going to just be this taxing experience. But don't undervalue what you're doing. What you're doing is something we call respite. So Nick and I have both worked with foster families, and those are families that have kids, and sometimes those kids that they take in are behavioral challenges or other things. And there's been times when our teams, which Nick and I have supervised, have gone in to provide respite, which is essentially what you're doing, which is kind of like glorified babysitting, but like, hey, we're taking this kid, they're going to be safe, and we tell the family, get out of here, go on a trip. Just go take time for yourselves, or we remove the child for a while and, have fun with them, doing other things with other kids, or take them on a camping trip. But we want the family to have respite. And that recalibration mentally is so important. And Ryder, you're providing that. And I just don't want you to underestimate what that is.
Absolutely. And that doesn't even take a lot. Like, you don't have to, you don't have to be providing respite for long periods of time. You don't have to really do it that often. I mean, I was a foster parent, and
that's right. I forgot that.
Yeah, I can speak to that. How just having that 1 week, even if it's just 1 week a year, that the kids go someplace else for a week, and you can just reset and get back to kind of a normal life. That's really all you need. It doesn't take much. Just that little bit helps out tremendously.
It's huge.
Yeah.
It removes a lot of the mental pain. And so I think we're both in agreement that the first thing we want you to understand is what you're already doing is really, really big. And the second thing that I want to kind of comment on, Ryder, is I do want to be a voice who's helping you to challenge some of that guilt that you're feeling. If you go back in our past episodes, Nick and I have talked about a cognitive distortion, which is called personalizing. And personalizing is whenever we're apologizing for the rain. Now, I'm great with you feeling empathy for the situation. I'm great with you as a member of the family feeling the burden of this and wanting what's right for everybody. But I also want to help you draw a little bit of a mental barrier here to not own a lot of this. At the end of the day, your father is an adult, and he is making a choice. And it's a self-sacrificing choice, as Jacob said. It's a choice that I think we admire, and I think is done in love, not just for your uncle, but for you, and as a member of the family. But that is his choice to make. And I don't want you to necessarily go cash the checks of grief and guilt that kind of come with that.
Yeah, I think just checking in every once in a while is just saying, hey, what can I do to help?
Yes.
And being proactive about it. Maybe if instead of waiting for him to get to that breaking point and contact you and ask for help, if you check in with him every once in a while and just say, hey, I got some downtime. Is there anything you need me to do? Any errands you need me to run for you or uncle or anything like that? Just being support for support
Odds
can be
and
very
ends.
helpful.
Yeah, or even offering to do like the online stuff to say, hey man, let me know if I can manage this or that online for you. I'll check it once a week. But Ryder, another thing I need you to understand is I think Nick and I both, we relate to you in a very real way because it is a very big part of our profession that we will sit across from somebody who is suffering. And they are in a situation like the father, if he went to see a therapist, this would be the kind of thing that we would overhear. We would hear them talking about how stuck they are and what to do. And we wouldn't necessarily have a solution in our pocket for that, right? We've got to meet people where they're at and just be part of the maintenance that helps them carry on. And so that feeling that you're having of feeling like powerless, like you want to help this person, but you really can't, that you come by that very honestly and very naturally. And that's something that every therapist has felt too. And I'll give you kind of a tip from our tool bag. What we try to do is, I think Nick says this a lot, we revert to the cheerleader, right? When we don't have a solution that we can construct for you, we're just going to chant your name and help you get over that problem and face that obstacle. And I think just being with you through that, empathizing, helping you get out your pain, like talking about it, even if there's nothing you can do with that, just being with somebody who is going through a hard time and hearing them and being present with them and feeling with them, you got to be just understanding, writer, that is one of the most valuable things you can give another human being. Even though it doesn't have a practical purpose, like you didn't solve the problem for them, it's extremely meaningful to do.
Right. And it sounds like there's other folks involved too. This is the part I didn't quite understand. It says, when my uncle couldn't care for himself, my father moved him in with his family, new wife and young kids.
Yeah, it sounds like Dad remarried because Mom passed.
So that's the dad's family, not Uncle's family.
So his uncle is his maternal uncle. It's
right.
Deceased Mom's brother. And
no, I got
father's
that.
taking this guy in.
Yeah, but the wife and young kids, I wasn't sure if that was the uncle had a wife and young kids or dad had a wife.
Yeah,
and
the
young
sentence
kids.
could go either way. I broke toward the father.
Yeah,
I took it as
sense.
the father had it.
So that's even more people involved in the mix, that
right.
Dad's trying to take care of.
Right.
Trying to take care of Uncle as well as the family.
Yeah. And
it's his dad's wife and young kids.
Okay,
yeah.
That's what I was thinking.
That's how I heard it. Yeah.
Because presumably if the uncle had a wife and young kids, he would already live with them.
Yeah, then that would be their problem.
That's what I was wondering.
Right.
That's what didn't make sense to me.
Yeah. So, I don't know. I mean, at the end of the day, writer, you said it in your question. You said, gosh, guys, I don't even really know what my question is, but is there more I could be doing? I don't see a lot of gap for that. I think what you're doing is already so meaningful and already very generous of you. And I also think that it's important you create a mental barrier to not accept the guilt for this. Your father is a grown-up, and he's making this choice. Mm-hmm. And I think we all admire him for it. But some situations are just, there is no way to solve it. And the best we can do at that point is just be humans to each other and help each other carry that burden emotionally. And I think that's what we can do. Yeah. But great question, man. And please pass our highest regards on to your family. I mean, don't do what you're doing. Go there and give respite, man. Just helping somebody reboot is such a big deal.
Mm-hmm. That's huge. And if that's all you can do, then sometimes that's enough.
That's huge. Yeah, it's absolutely a big deal.
All right. Thank you for writing in. And we're going to take a quick break. And when we come back, we discuss toxic in-laws. You're listening to Pod Therapy.
This week's Theraproducer sponsor is Robert Brownie Jr. Mint. Mr. Mint was an American musician and singer-songwriter who was a central and pioneering figure of mid-1950s rock and roll. He was born in Lubbock, Texas, to a musical family during the Great Depression and learned to play guitar and sing alongside his siblings. His style was influenced by gospel music, country music, and rhythm and blues acts, which he performed in Lubbock with his friends from high school. In 1955, after opening for Elvis Presley, he decided to pursue a career in music. He was among the first artists inducted into the Rock and Roll Hall of Fame in 1986. Rolling Stone magazine ranked him number 13 in its list of 100 greatest artists. If you know who Robert Brownie Jr. Mint really is, you can tell us in the comments at patreon.com/therapy. Come on down to patreon.com/therapy and sign up to support the show.
We're back. You're listening to Pod Therapy. Our next question is about toxic in-laws.
Is my wife's family toxic? Hey guys, I'm not in any position to make a diagnosis, but my wife's family is basically the embodiment of the DSM-5. Okay, well, thank you for refraining from making a diagnosis, just throwing the book at them. I'll try to be as brief as possible.
What is that?
The DSM-5 is
Diagnostics and Statistical Manual for Mental Disorders, 5th edition.
Let me give you the non-asshole answer.
5th edition.
Yeah. Oh, I didn't catch the 5th edition.
I didn't realize they put out a 5th edition.
Oh, I thought I meant the 4th
If
one.
I just said DSM, then he'd be like, well, what's 5?
I think the answer to Jacob's
thing
question is it's the diagnosis code book. So, like...
It's a psych book.
It's it. Yeah,
Right.
That's it. It's the diagnosis Bible.
That's
You
all
don't have to
that's
tell
all
them
I
it's
was
the
looking for.
statistical manual.
Oh, no, hold on. If I had not said that, damn sure that's exactly the words that would have come out of your mouth.
You have no faith. That's what this is. It's just, I'm a simple man.
We have it on recording. I can go back to earlier episodes.
All right.
We'll settle this later.
I'll try to be as brief as possible, but I think I need to lay out a little background for you. My wife's family, her parents and her brother, live about 8 hours from us. They live off the grid, no power, in the woods of a 55-acre piece of land. It's not quite as isolated as it sounds, as their nearest town is about 20 minutes away. Their lifestyle is basically camping, outhouses, coolers with ice, heating water with a wood stove, etc. So we've always worried that as they aged, there would be some issues with them being able to keep up and maintaining their basic needs. And recently, they've been without a car. Her brother had been staying with them lately, and he is abusive towards them. He would do things like throw their stuff around. My wife was on the phone with her brother, and she said something to him in their defense, asking him not to hurt them. And he got angry, hung up, and threw the phone at the mother, causing her to be hospitalized and need stitches. Luckily, they were in town. He had just given them a ride into town to look for a vehicle to purchase, and a bystander saw this and called the police, and the brother was arrested. Against my wife's advice, they bailed him out, and he, against police orders, came back to their house. He has not even apologized for hurting her and is more concerned with his own legal troubles because of the incident. He told her, the mom, to lie to police and say that she fell, but Dad told the police what actually happened. Brother is currently not there, but they, the parents, and we are fearful that he may come back and that being more remote will not make the situation better. My wife's dad, through all of this, has not been doing very well. He had been extremely anxious about their car situation and money. He has been saying that he wants to kill himself and that he and his wife deserve to be dead. They got him to a doctor, and they put him on a low dose of anti-anxiety medication. He is convinced that it is a poison and not being reasonable about taking it. Her mother is rightfully worried and doesn't really know what to do. This has resulted in multiple calls and texts daily at all hours to my wife, almost always in a panic asking for help. My wife has advised them to seek counseling, which they do have an appointment for, but it's not soon. The first appointment was 6 weeks out. My wife, who is also on anxiety medicine, doesn't really know what to do and is getting overwhelmed and also feeling helpless because we are too far to help if there was an emergency, and we're unqualified to give them the help they really need. Effing you in the effing face, Anonymous Scoop.
Okay, so first off, safety is the biggest concern.
Yeah, tippy top.
Yeah, so that's always going to be the first thing that we look at, any way that we can mitigate danger, decrease risk of somebody coming back, somebody dangerous or harmful.
Yeah.
And one of the things that I've said before in this podcast is the best predictor of future behavior is past behavior.
Right.
If someone has shown tendencies to be violent in the past, then they're likely to become violent again in the future.
Yes.
So that, I think, has to be the number one concern, whatever way possible. I mean, any ideas as far as what they can do to get... They've already got the police involved.
Right. That needed to happen.
Yeah.
And so, I didn't like the part where the brother was asking the mom to hide this.
Yeah.
And don't tell them that I beat you, basically.
Yeah.
But the dad thankfully did the right thing. And by telling that truth and allowing the police to know this, it's hard to enforce the don't come on the property rule because they're out in the rurals. Mm-hmm. But they're not in the middle of, some island somewhere. Like, they're still in the continent and there's still police force. So, as long as phones work and things, they just need to be reactionary. The brother needs to stay off that property, period. Now, obviously, nobody has direct control over that. Brother's going to do what brother's going to do. So I think the first point there about safety comes down to making sure as the family that you are continuing to make a point to the parents. Guys, it is unacceptable for brother to come back to that house, to that area. That is unsafe. It is not going to work for any of us. Don't make excuses for him. And if you guys don't call the police, I will. And just kind of creating that kind of tenor. That way, hopefully the parents will kind of enforce that boundary. But Nick, I think that the real danger zone is the father. Who's saying, I want to kill myself. And an interesting piece there, which I have a million questions about, is saying, my wife and I, the mother and the father saying, my wife and I don't deserve to live. And I'm wondering what that is.
Yeah, that kind of caught my attention too. It's one thing if somebody is saying, I don't deserve this, but to say we, now that
and where
throws
does that come
up
from?
A lot more red flags.
Yeah, maybe they are concerned that the brother wasn't raised right or something, or maybe they're just suffering and they're just in a place of we don't deserve to live because we don't have money. I don't know. But whatever it is, the red flags are scarlet.
Yeah.
I mean, this is something that, and obviously you guys did the right thing. You got the counseling appointment. This actually introduces, I think, a good question for the general audience. A lot of people will bring a patient to me and say, we came in as soon as we could, and my calendar is not 6 weeks out. A lot of times people can book me the next day, and I'm really proud of that. Like, I have an online calendar. It's really easy for folks. And so it's very typical that I'll meet somebody and they'll say, we booked this appointment last night at midnight because this member of my family said something like this, like that they're suicidal. And half the time they expect that I'm going to legal 2000 the person and take them into custody, right?
Legal 2000 meaning?
Oh, taking them, so put the person in a psychiatric hold.
Right.
So it's kind of like a chokehold. It's behind the back and over the
Except you're
shoulder.
using psychic powers?
I use my psychic powers. Yeah.
I think that's in the DSM-5.
It's yeah. What is the DSM-5, Nick? Can you give us
it's a book.
publishing date?
Assholes.
The copyright, please.
So a legal 2000 is what we call it here in Nevada. It's called something else in
Baker
like every
acted in some
different
places.
state. But basically, if someone is a threat to themselves or someone else, a licensed psychologist, a licensed social worker, a therapist,
Or Jedi.
can contact the law enforcement, and they can actually put them on a 24-hour hold.
72.
72-hour hold. They'll put them in the psych ward. They'll observe them, and then they will get released when that psychiatrist determines that they are mentally and emotionally stable.
Correct. And so a lot of people have this idea that whenever you come into the office like that, like in this abrupt way, that's what I'm going to do. And more often than not, of course, that's not what we do. More often than not, the fact that you're even making the appointment and talking to us signals that you're not in imminent risk.
Right.
But this is par for our course. Should you be attended to? Yes. Is treatment required? Yes. But the fact that you are taking the meds, or, well, that's another thing, is like Dad's not taking the meds in this case. He's saying that they're a poison. So there really is, cause here to be concerned about the father. The most encouraging thing is that there is that appointment. It might be a good idea if you can facilitate it, maybe a phone appointment if you can get in sooner than that.
Yeah.
I think
even
that
if
would
you
be a good
can
idea.
contact the person and just explain the situation and say, I don't think we can wait 6 weeks.
Right.
Then they can put you on a cancellation list. If somebody cancels or something
That's
opens
right.
up, they can get you in a lot faster.
And remember this too, a lot of states, I believe almost every state now, has another emergency system. It's dialing 211. And so you can dial 211, and basically what that is that's the behavioral and mental health emergency line. And so you can call that and say, listen, this is the kind of stuff that father is saying, father-in-law in your case, writer, and I'm just worried about them. Here's their address. And what they can do is they can actually have a social worker come out and just do an on-site visit with them, just to check in. And it's basically a wellness check. But if we're at that place where, father-in-law's not taking the medicine, father-in-law's talking about suicide and homicide, and father-in-law is willing to go to the appointment, but we're a month and a half out from that, dialing 211 might be the right move, or even 911 or 311, and just explain to the dispatcher what your concern is. And in theory, they should be able to mobilize a unit to go visit with that person. And it's not going to be a cop. I mean,
Right.
They will send a cop if it's a wellness check to make sure the person's not going to hurt themselves.
Right.
And the police are usually prepared to have that conversation on the scene and not be threatening. They're there to talk. But most states now have essentially a shrink squad, and they can send that person out. So 211 might be a good option in this case.
Yeah, it's also, I think, it's the silver lining here with your wife who's on anti-anxiety medications. And hopefully her being on those medications and having contact with her dad, maybe that will help kind of convince him that, these meds are safe, you're going to be okay to continue to take those.
And so that's actually a good point, Nick, because the brother is part of the triangle here. Obviously, that's just a criminal thing. Like, that's just a keep that person away kind of thing.
And I want to touch on that, too.
Yeah.
When we get to it.
Go for it, yeah.
Well, because to me, everything about this really echoes the domestic violence pattern.
Yes.
Right? Of he's becoming violent, he's got power and control over the family, and then when things go bad and then the law enforcement, then he's got to play this completely different role. He has to use his power and control to influence the victims to not report him.
Right.
And to get him out of his legal trouble.
Yes.
And then ultimately uses that back onto the victim, saying this is your fault that I'm in this situation. If you hadn't contacted them. So this whole thing just reeks of a domestic violence cycle.
Yes.
One thing I would encourage you to do, and this would be good for your parents to actually take a look at, just go onto Google and Google power and control wheel. It was developed by, I think, University of Minnesota Duluth, and it's basically it's all about...
Real quick, turn safe search on first, and then do that. Yeah, just so it's family-friendly show.
You'll find on there from the National Center on Domestic and Sexual Violence, they've got the power and control wheel, and it breaks down all these different areas. There's 8 different spokes on this wheel, and each spoke is a way that somebody can maintain power and control through manipulation over their victim. And this is really helpful. A lot of times we would use this when we talked about domestic violence when I was working in an all-female recovery home.
Yeah, Duncan.
Yeah, because we would... so many of them were victims of domestic violence, and
Yes.
I would actually run a group talking about this, and it was interesting for them to see this and be like, "Oh my God, yeah, he did that.
Right.
Oh wow, he did that too."
Exactly.
And they didn't realize it at the time. And so actually going through and having your parents look at this and being able to kind of educate themselves on the way that the perpetrator will maintain power and control through manipulation
Yes.
over them, it will enlighten them, and it kind of opens up their eyes to being aware of when he's doing it and how he's doing it.
And it will reinforce that boundary.
Yeah.
Because I think becoming aware that this is the cycle helps you to feel more confident whenever you're saying no to this person, because they need their own help and that brother needs to leave. So that's a really good point. What just for the record again, what's it called? The power?
It's the power and control wheel.
Power and control
If you
wheel.
just Google that, it's going to be the first thing that pops up.
Yeah. And the third piece of this triangle, we've talked about brother, we've talked about father, and I want to talk about wife, because wife's going through her own thing. And whenever you're getting these constant calls, God, this reminds me of running the rehab. When you're getting the constant calls in the middle of the night, panicked people on the other side, asking you to solve the problem or just throwing their hands in the air and saying, I don't know what I can do, what are we going to do, what are we going to do, or whatever's going on, that is maddening. And that will just continue to erode your own ability to just concentrate and live your best life, because you'll start fretting about that. You'll start worrying about that. You didn't mention if wife was in counseling, at least as far as I could tell. I saw that she's taking an anti-anxiety medicine, which is good. I just want to just be a voice in your life to just give you a little bit of this. And I'm sure you already know this, but just for the sake of everybody, always keep in mind that medicine is a great part of the toolkit. It's part of the solution. It very rarely is the solution. And especially with anxiety, the medicines can biochemically recalibrate a little bit. But at the end of the day, her anxiety is of a contextual nature. It's not like she's, out of balance in her biochemicals. Primarily, it is the family drama, and it is her being swept up in it and feeling this need to protect people and having the anxiety about how do I solve this, what do I do, and worried. That is something that a therapist could help her rearrange and work with her to have more solution-focused behaviors and thinking that could be helpful to the family, but don't cause her to suffer. So if she's not already, I would strongly encourage her to also pursue her own therapeutic work.
Absolutely. I think, there should also be a discussion about boundaries within the family.
Yeah.
And that's going to be very difficult because obviously I'm sure even though their son is doing all of this stuff and becoming violent, they still love their son.
Of course.
And sometimes it's very difficult for family members to call the police or to be honest with the police about what's going on and to honestly say, yeah, I don't feel safe around him.
Yeah.
Right. And I think sometimes maybe that even feeds into the depression or the feelings that the parents have.
Yes.
That would be difficult to say as a parent to say, I don't feel safe around my son.
Right.
And that's probably then turned inward towards, did I do something wrong?
Right.
Raising them.
Right.
So maybe that's where some of that's coming from.
And
too.
also we need to be careful not to miss the point here also that there's so much pain probably in the parents. I mean, to be victimized by your own child is a weird situation to be in. Obviously I don't mean to make light of it, but, I have a 9-year-old and a 4-year-old, and my 4-year-old, dude, she just roasts me. There's times when she's just ruining my life. And it's like, I am being, wounded by you, but I love you. And so, what do you do? And so, creating that boundary with your own child is probably up there with the most difficult things we can ask a human to do.
Right. And I think
painful.
it goes against instinct, right?
Right. Of course.
Because your instinct is to protect your children. You don't want to ever see anything bad. We would run into this all the time at the rehab.
Right.
Where, the parents would say, well, I can't call the police on them. I can't do this. I'm like, why not? Because it goes against that instinct.
Yes.
But that's sometimes what they need. They need to be held. They're adults now. They need to be held accountable.
How many parents
for their
have told us,
behaviors.
I'm trying to protect him from the law. Why would I call them? I'm bringing him to you because I'm worried he's going to destroy his life. Why would I help him destroy his life? And we're trying to help them understand, no, you have to let them experience their natural consequences, otherwise change is not possible.
Right.
You can't keep touching the hot stove on their behalf and then tell them don't touch the stove. They've never figured it out. Yeah. Pain teaches people. Pain is our greatest teacher. But, to the writer in this one, you are going through a huge family circus in this case. And, it isn't that your in-laws are toxic. It's that your in-laws are suffering. And I think that they're going through a lot. And I think that you rightly want to see them get help. Your brother-in-law is toxic in this case, is dangerous, and has demonstrated that. And I think, again, going back to that domestic violence wheel, like that says a lot about the behavior pattern. And attend to your wife, writer. I mean, that's your role at the end of the day. These are her parents. These are her people. Your job is to attend to your wife. And so I think being that person in her life where she can vent and get these thoughts out there and share her fears with somebody, and even if you're just coming back to her with a soothing tone or helping her restructure that thought to understand where her responsibilities end and where she has to allow other people the dignity of choice. And if the parents are going to make bad choices and allow brother back in or whatever, that may cause her suffering and pain, but at the end of the day, she does need to accept they have the dignity of choice, and that's not her call. And if that happens, she needs to allow herself some mental distance from that. So that way she can't suffer with it.
Yeah. Hopefully that's helpful. Try out some of that stuff and let us know how it goes.
All right, man. Hang in there.
All right, we're going to take a quick break, and when we come back, we discuss initial therapy sessions. You're listening to Pod Therapy.
This week's TheraProducer sponsor is Kayla Lansbury. Kayla Lansbury was an American singer, songwriter, and guitarist, a rock and roll pioneer, and a forefather of the Chicano rock movement. Kayla's recording career lasted only 8 months. During this time, she had several hits, most notably La Bamba, which she had adapted from a Mexican folk song. Lansbury transformed the song into one with a rock rhythm and beat, and it became a hit in 1958, making Lansbury a pioneer of the Spanish-speaking rock and roll movement. She also had the American #2 hit, Donna. If you know who Kayla Lansbury really is, let us know in the comments at patreon.com/therapy. Again, support the show at www.patreon.com/therapy.
Obviously, Chuck Berry.
Nailed it!
Obviously. Chuck Berry's rendition of La Bamba was great.
Yeah.
Spectacular.
Just one of those things that's like buried in time. People never play it.
Chuck buried in time.
Are we back?
Okay, yeah, we're back. Next question's on initial therapy sessions.
Intake session question. Hey guys, I recently graduated college and got my first ever full-time job. Way to go! With those 2 life events came a lot of new emotions and hopefully emotional growth. I also now have my own health insurance for the first time in my life, and because of you two, I've decided that I really should see a therapist in my new city. I'm not sure if you've already covered this, but I would love a breakdown of what to expect at initial consultations. Is it mostly small talk? Do I spill my soul? Thanks, guys. Anonymous. Awesome! What a cool letter. That's great, man. Great to hear it. Or madam, whoever
Right.
you are. That's fantastic. So, really glad that we could nudge somebody towards seeing a therapist. I wasn't sure how to take that when it said, because of you guys, I'm going to go see a therapist. Okay. I'm going to take it as a compliment.
Honestly,
Either way,
it's a
that was
compliment.
the point of the show.
Yeah,
the show
that
is
was-
to nudge people toward helpers.
Yeah.
If we did that by just ruining them,
Yeah.
I'm glad we could be of service.
If that letter came into Ice Cream Social, I'd take it a very different way.
Because of you guys, I'm seeing a therapist. We apologize and we hold no liability. So, Nick, intake sessions, what do you think?
Yeah, we have talked about this before in previous podcasts. And then I've talked about this a lot with people I know who go into therapy. And it is important to kind of have the right idea of what the first session is going to be about, because I know a lot of people who go into that first session and kind of leave a little disappointed because they thought it was going to be more than what it really was.
Right.
Just be prepared your first session. The therapist is really going to guide the process, but for the most part, this is going to be a time where they're going to do like a biopsychosocial assessment.
Right.
Right. They're going to.
So what is that?
They're going to collect information.
Why do we call it a
you.
biopsych social?
I'm getting to that.
Okay.
Jesus.
What does DSM stand
Will
for?
you calm down?
I'm helping.
Okay. So biopsychosocial assessment, essentially the therapist is going to collect information regarding biology, psychology, basically your health, but then also how you're thinking and behaving, your social group, social activities, behaviors, things like that. Biopsychosocial assessment.
Right.
So It's going to cover a lot of different information. You're going to talk about, how you grew up, your family, your nuclear family, your extended family, your relationships, previous mental health experience, substance abuse, if any. It's going to talk about symptoms. Just
Right.
They're going to be collecting a whole bunch of data.
Survey of information.
Right.
And so that's what they're going to do when they first meet you and different therapists do this in different ways. And I would just encourage you to be gracious. For me, I'm really proud of my intake process. I've intentionally designed it to be very quick. I have very minimal paperwork for people to fill out. I don't need to know what color their grandfather's eyes were. And then I usually try to put them at ease pretty quickly and just get to know them.
Yeah.
So the question I usually ask when somebody sits down, it's funny, I have like an opening bit that I always say, but I usually say, my first question when I get to meet somebody new is, how did you hear about me? How did you find me? And then people tell me, I found you on, the FBI most wanted list and thought, why not? I'd check in with you. Great. And then I'll say, so what brings us here today? And that's kind of their cue to say, all right, here's what's been going on. Here's the problems I want to address. And I usually have given them a form in the lobby that they can kind of specify that too. And
Right.
So that kind of becomes something that we're going to create together called a treatment plan, which kind of teaches me like, what are your goals? And like, how am I going to help you with those? So usually that first session is a little bit of surveying, like what Nick's talking about, biopsychosocial. Sometimes it is a very official thing. And sometimes it can be very formal where there actually is quite a bit of paperwork and the therapist might be writing a lot more than they typically would be in other sessions.
Yeah.
In my experience, for me personally, it's just as casual as meeting somebody new and just learning about their history. And I have a million questions. And so it's me being nosy and learning a lot. And then I try to budget a little bit of time at the end. And this is what's going to also happen for you, Ryder, for us to go over the odds and ends. We're usually going to talk about HIPAA. We're going to talk about confidentiality. We're going to talk about your rights as a patient. We're going to talk about the way that you and your therapist communicate. Like, are you allowed to text them? Can you call them? Can you email them? How does that work? And then they'll usually talk about things like billing. If you're using insurance, which you are in this case, they'll usually take a copy of that while they're sitting with you and let you know anything you need to know administratively about all that too. And again, keep in mind that a therapy session is 50 minutes. Sometimes intake sessions are longer. I think a lot of people will actually bring those up to, 90 minutes?
Sometimes, yeah.
Yeah, a lot of times they are. Mine are.
Yeah.
Mine are still the same hour. But yeah, a lot of times it's longer.
Well, and Jim brings up a good point, too, which is that everybody's going to be doing it differently. Every therapist kind of has their own way. But one thing I want to caution you on is I don't think that any of those ways mean that they're a bad therapist.
No.
Right? Because there can be, we can't say like good therapists do it this way. And if they do it this way, then they're a bad therapist. Everybody does it different. It depends on the therapist. It depends on the patient. It also depends on the method of payment.
Yes,
Because
very much so.
You can afford to have a really short session because for the most part, if they're paying out of pocket,
Yeah.
the amount of information you need to collect is just for you to know.
Yeah.
Whereas if you're billing insurance does care what
They
color
do. The
eyes the grandfathers
Yeah.
had.
We're exaggerating, but not by much.
Yeah. So so a lot of that depends too. Like for me, when I was in practice, a lot of times the stuff that I had to gather, it seemed like it was just so much that I actually broke it down into like 2 or 3 sessions.
A lot of therapists do.
Where I'll collect enough data to say I've got enough to kind of start with, and then we just kind of have a conversation. And then in the second session, I'll pick that up again. I'll do the second half of the assessment, and then kind of.
I'm actually really glad that you differentiated that. And for the general audience as well as the writer, I think this is a good moment for us to speak to this. Your experience visiting with a therapist for the very first time will be different depending on your method of financing what you're doing with your healthcare, right? So in my experience, all of my patients are cash pay out of pocket. I do not take their insurance. That's a choice I've made for lots of reasons, but it's the choice I've made. And so the patients that I see, I collect as much information as I believe is valuable to treat them. And that means that I don't like to give them a catalog of paperwork. I also don't have to diagnose them.
Right.
I can just visit with them. I don't need to do anything. There's nobody looking over my shoulder. Nobody's checking my work. I can just be real with them. But if you're taking insurance, you do have some very real world burdens. And that can sometimes complicate that first phase of the relationship because your therapist can sometimes come off a little bit mechanical. And it's like one of the things the writer said is, should I bare my soul? No, not in the beginning, because honestly, they're probably not they're not able to accommodate that. And Nick and I have both worked in the insurance side of things where sometimes that patient really is showing up ready to share and they have so much to unbear and get out there. And sometimes we actually have to stop you and say, we're definitely going to dig into that. But right now, I need to know what's your blood type.
Yeah. And that sucks.
It's terrible.
I hate doing that,
It's
but I've
terrible.
had to do it a few
and
times.
I have to do a DAST. I have to ask you, how much do you drink alcohol? No, not really. Okay, I need to ask that same question 10 more times
Right.
in different ways, and I have to have answers for them.
Yeah.
You know, and like, have you had suicidal ideation? No, I told you that. Okay. Have you had thoughts of killing yourself? What? No, I already said no. Have you felt depressed? No, I'm here for anxiety.
Yeah.
It's like we have to go through this checklist of things, especially depending upon what kind of insurance it is, to create the documentation that the insurance needs for us to get authorization to treat you.
Yeah.
And that means that we are fishing for what you don't have, we're fishing for what you do have, and ultimately, do not keep your stuff a secret. If you're using your insurance and meeting with somebody, do not bury the lead. Don't make your therapist play a guessing game to figure out what's wrong, because they need to know in order to get your insurance to say yes.
Yeah.
So if you're having anxiety, tell them. Like, whatever it is, don't bury the lead, but don't be disappointed if you don't get to have a robust conversation with all the stuff that you've really prepared yourself to reveal. And don't give up on the process just because that first one is a little bit more administrative. That's pretty common.
Yeah, your first session isn't going to be a good indicator of what the rest of it's going to be like.
Yes, and so don't be discouraged, writer. Do not be discouraged. You're doing the right thing. The first session is a little bit more of a business session, and that's okay, and it just starts the conversation, and then when you come in the second time, that's whenever you're going to feel a lot more heard and a lot more connected with, and that's when that therapist can really settle in and do what they're trained to do. The very first session, most therapists have to behave like an insurance auditor. After that, they can settle in and do their job. But, that still doesn't mean don't do it. It means get in there and get that one done with.
Yep.
And now I'm glad you wrote in, because now we can prepare you for what to expect, and that's not a bad thing, and now you'll come in equipped.
Yep.
But
Absolutely.
be as honest as you can, and then don't be disappointed if it doesn't go very deep the very first encounter. That's where you're starting the relationship and starting the conversation. Okay,
Yep.
And then you don't have to figure it all out in the first go. You guys will develop the conversation as you go.
Yep. Absolutely. Just be open to the process.
Yeah, and thank you for going. That's
Yeah.
fantastic. And
Good job.
everybody out there, remember, you can go find a therapist, and you don't have to be broken before you're allowed to go see one. It doesn't not like you have to have a diagnosis necessarily. You're allowed to go. The therapist's job is to do the paperwork and justify it. Let them do their job. Your job is to make that appointment and get in there. I said this on the news the other day. I think that this is true. I think every family should have a family therapist the same way you have a family doctor. It's just the one you go to. And so they've met you, they've met your family, they know who you are, and then you see them twice a year until something bad happens. And then you go in and say, hey, we don't have to start this conversation from go. We already know each other. Here's what's happened. And then you can get into it. And I love it. I think that's a maintenance strategy.
Very good. Thanks for writing in.
Thank you for writing in. Well, we are at the end of the show, Nick, and we've got some things to talk about here. I do not have the plethora of apologies that I did have last show, but I do have one that I would like to apologize to. Dear the city of Denver, Colorado, I'm sorry that I called upon President Trump to launch nuclear missiles in a preemptive attempt to prevent the prairie dog infected plague from spreading outside of your city. That was probably an overreaction. So, namaste.
Perhaps.
Maybe. But you know what? This is essentially the zombie apocalypse. Okay, I don't know if you've been reading the news.
The prairie dogs?
The prairie dogs are infected with plague.
We've survived grasshoppers. What are prairie dogs going to do?
The grasshoppers didn't have the plague. They were a plague. These things carry a disease, man. They've got bubonic plague, and they're just spreading around, and apparently we've lost Denver. So what are you going to do? Okay, nuke it now, because once it spreads, we're screwed.
I saw this movie, Outbreak.
Yeah. Oh, that's what this is. Yeah, this is World War Z, but prairie dogs.
But we can treat plague.
Oh. You know what?
All right, never mind. Never mind.
Call
We're
it
all
off.
good.
Call it off. Jesus, no. I'm sorry. Have you seen the advertisements for the new? You remember Sharknado?
Yeah.
1 through 10. There's now by the same creators of Sharknado. There's a new one, and oh god, it's called Zombie Tsunami, and it's a tsunami. And then zombies come in it and then wash up on the beach and attack everybody. And so the city's flooded with a tsunami and zombies.
And then zombies.
And zombies.
Why not?
Yeah. So that's it for my apologies today. I just had the one.
And we want to thank our Patreons who support the show, and you can too at www.patreon.com/therapy. We have a new THERAPOD this week. Welcome to the show, Tom Morrison.
Tom Morrison jumped in at 15, man. So he jumped in at like Alpha THERAPOD, just jumped right up to the top. Tom, you're $5 away from being a ex officio board member of the TheraProducers. I mean, I'm just saying. So, scrap a Starbucks and throw it in the kitty, and, you'll get mentioned every show. It's pretty cool. Once you break $20, you just get noted every single show. It's fantastic. Speaking of which, Nick, who are our TheraProducers?
We need to thank our bosses, the Elite Eight and mysterious and shrouded Illuminati members of our fan club, the TheraProducers. Thank you, Smitty Scoop, Jake Schneider, Robert Brownie Jr., Mentz, chairman of the board, Kayla Lansbury, David Data Scoop, Violon, Judy Schneider, Nathan's Hot Dog Scoop, Dr. Ben Dawn, and ex officio board member Ellie O'Dare.
If you would like to hear this episode uncut and unedited and enjoy our spontaneous side projects such as book clubs and know who the anonymous sponsor was that hired Dr. Drew to endorse the show, you can go to patreon.com/therapy and sign up. And thank you for supporting mental health. That's all the time that we've got for this week's session. We want to thank our landlords, the Ice Cream Social Podcast, and thanks to those of you who contributed to our show today. We really appreciate it. Remember, pod therapy isn't something you should keep all to yourself. Help us reach others by opening this episode's description in your podcast app and copying and pasting the link provided into your social media. Don't forget, you can find us at facebook.com/podtherapy, on Twitter at PodTherapyGuys, and now at patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tangent.
I'm endorsed by Dr. Drew.
Thanks, and we'll see you for your appointment next week.
Oh, and the naloxone thing.
Spoiler.
Yes.
It was neither Nick nor I.
It was Colonel Mustard in the library. That's where it was.
Yeah.
Anyway. All right. So the Patreons already know the horrible truth that I basically bribed.